Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in.
Welcome, and thank you for joining another episode of the INS Infusion Room. We are live in the exhibit hall recording our special series from INS 25.
Yes.
And I got a special guest today, Jennifer Mendez, and she's coming from quite far away.
Yes, coming all the way from Qatar.
How were your travels?
I was good actually. I went to the UK and then all the way to Las Vegas.
You're from the UK, right?
Yes, I am from the UK.
Did you get to visit some family while you were there?
Yes, I visited. Yes, I had loads of fun with family before I came all the way to Las Vegas. I'm here, INS 2025. Thank you.
How's it been so far?
It's been great actually. I've seen few people. I've seen friends. I've seen family because my family lives in Colorado as well.
Oh, wow.
Yes. So yeah, it's been wonderful.
Great.
Thanks for having me.
Yeah, we're happy to have you. So lots to discuss here. But before we jump into, I'm going to have you talk a little bit about yourself. Maybe tell our listeners about your personal and professional experience and what's led you to your work that you're currently doing, which we're going to talk a little bit more in a minute.
Okay. As Derek said, my name is Jennifer and I'm from the UK. And I've been a nurse for 16 years. And back in London, I worked as an intravascular access nurse. And I worked in London for about 7 years before I moved over to Qatar. I've been a vascular access nurse. I enjoy it. I love what I do. And I've also done quite a lot of work around neonates and pediatric patients. So it's been a pleasure, and I'm quite happy working as a vascular access nurse.
So your work in Qatar, what took you there?
Okay, so I had a friend of mine who relocated from the UK to Qatar, and they loved it. It's a lovely place to be. It's a nice place. There's so much to do in Qatar, and it's a beautiful country. It's very safe.
So you moved there with a friend.
A friend moved before me, and then I moved afterwards. Yes.
And then you jumped into some professional opportunities.
Yes. So while I was in Qatar, there's a new hospital, Sidra Medicine, and opened up its door in 2018.
Okay.
So they were looking for vascular access nurse and oncology specialist.
Now, was that new for them in that area?
100%. Yes,
that specialty was new,
yes,
right?
It was new to them, yes.
So you said, hey, I can do that. I can do that.
Do it, yes. So I moved to Qatar, activated the hematology oncology infusion centers because back in the UK, I was an oncology specialist nurse before I moved to Qatar. So, and then I worked as an intravascular access practitioner as well back in the UK. So moved to Qatar and I activated the vascular access team in Sidra Medicine. Yes.
So when you activate that, there's so many questions around this.
Yes.
Especially if you're looking at a new specialty or nurses moving into a space. Now, at that time, were physicians placing these lines that you now are stepping into?
Yes. So predominantly in Qatar, physicians place all the central lines.
Okay.
Yeah. So at the moment, we're moving over to vascular access team placing central lines, and not just that, because when I moved to Qatar, we had approximately 77 incidents related to vascular access. So when I activated vascular access team, 3 months later, we had a 13% drop. Basically, 13% drop in the reported incidences in vascular access.
So walk me through this. You start your position.
Yes.
Were you warmly welcomed by everyone?
It was a lot of challenges.
Because
A lot
why?
of
Because there's
challenges.
change.
Yes.
And change is difficult.
100%. But the good thing about Qatar is that they're very receptive.
Oh, wonderful.
Very, very receptive. The physicians are very engaging. So on activating, we had the ICU doctors who were part of the team. The chief nursing officer was quite engaged. The leadership of Sidra was quite engaged. So that made a lot of impact in the amount of results that we got on activation.
Great.
Yeah.
So then how did you bring on nurses and start that training? I mean, you had a significant decrease in a
Yes.
very short period of time.
From 7 to 13% in 3 months.
And I know you're talking a little bit about this at INS 25, so we
Yes.
don't want to give away too much, but if you can provide me maybe how many nurses did you initially bring on?
So initially we activated, I think, with 5 nurses and with no background in vascular access. I had to train all of them
goodness.
from scratch.
Oh, goodness.
Yes, so train them from peripheral IV insertion up to long line insertions.
Wow.
Yeah.
And what did that training look like? Was it difficult? Did you have the available resources?
Because back in the UK, I had access to INS. So
Yes.
I actually tapped into INS standards of practice, procedures. We standardize it. Actually, it's part of our policy in Sidra. So we're in line with every INS
that's
standards.
wonderful.
Yes, it's part of our policy. And so all of my nurses were trained using INS guidelines and procedures. And currently, I have 3 of my nurses that are CRNI certified.
I was going to ask that because we did see an uptick in that area with CRNI. So we are officially,
Yes.
we have nurses representing from CRNI
Yes.
in your area.
A lot of my nurses were quite interested in INS because obviously we trained with all our standards of practice from Infusion Nursing. So at the moment, I think I registered about 10 of them. So I have 10 nurses who work under me as vascular access nurses.
Wonderful. And
Yeah.
and that was since 2018, you said?
So in 2018, we activated and with 5 nurses. And then around 2022, we increased to 10 nurses.
Wonderful.
Yes.
So you plan to certify all those nurses,
100%.
right? And what makes the difference? Why get CRNI?
I think CRNI is a really a certificate that works for majority of infusion nurses vascular access. And when you look out there are so many, obviously so many bodies, so many guidelines, so many certification. But with INS, it's quite a very everything is about scientific.
Yes.
Everything with INS is it's not just about the standards of care or standard of guidelines and procedures. It's more about how the nurses are governed, what they do, and how we do things in infusion nursing. So hence, I wanted the CRNI certified. They're not just vascular access nurses, but they're also infusion nurses, because we're not just looking at vascular access. And one thing that I actually established in Qatar is looking at not just putting a line in and walk away. So we look at maintaining those lines from insertion to management, and hence my team, we're called Vascular Access Management Team.
Wonderful. So you're owning those catheter devices. Once you place them, monitoring after, you manage all. That's wonderful. You're doing wonderful things in that area, and I cannot commend you enough.
Thank you, Derek.
So you talked about INS being able to provide you guidance and resource.
Yes.
Can you give a specific example about how it has improved patient care? Have any patient stories or testimonies?
Yeah. So a lot of because not just like I talked about maintaining those lines and not just putting them in. So we have looked at so many different things, from complications like central and associated bloodstream infections. We've looked at extravasation management. We looked at the way that we put in PIVC in our neonates and pediatrics. So the good thing about INS is not just aligning it to adults, but also specific to neonates and the pediatrics, which is an advantage to us, because when we activated, we looked at how do we manage, because our neonatal population are quite complicated. But when you look at INS standard of practice, the procedures, it kind of guides you around managing those patients. And it's for us, it was a huge advantage that we can tap into such resources even while we're in the state of Qatar.
And speaking of resources, have you used Ask IV?
I have seen Axe IV. We haven't quite used it yet, but we're in the process of doing that.
Yeah, we have a booth. I don't know if you've used it over here or not, but
I'm definitely going to visit the Axe IV.
oh,
Yes.
she's wonderful. So Ask IV, for those who don't know, it is a AI chatbot that we use to ask clinical questions.
Yes.
And she answers those clinical questions by only referencing the standards of practice.
Oh, that's amazing.
So we do know that there are AI chatbots throughout the internet, Google,
Yes.
and with those, they do source multiple sites.
Yeah.
With Ask IV, we can guarantee that she only has one source. And that's the standards of practice.
That's fantastic.
And I'm not saying that you should only use one source, but in regards to referencing the standards of practice, it's a great tool to get a quick answer from the standards,
or fantastic.
Find what you need within the standards of practice.
Oh, that's really good. I mean, I've seen Axe IV so many times on the INS website.
Yes.
And sometimes we do have complicated questions from physicians. We literally run to INS to look at answers to those questions. But yeah, definitely something that we'll tap into. Yeah.
So, in final thoughts, can you give nurses that maybe don't have guidance, or maybe they want to establish what you've done in their area, can you give any words of wisdom?
100%. I think I would say at the beginning, there are loads of challenges. Okay. It's not very easy to get into changing people's mindset, changes people's perspective about what you do. But be rest assured that those neonatal populations of pediatric patients that are quite vulnerable, you can make a change. You can make a significant impact in the amount of complications, particularly making sure that we manage all our complications and not intravascular access devices are very easy to use, but there's so many things that can go wrong. So for establishing, I would encourage every hospital to establish Infusion Nurses vascular access team, because they do make a significant impact in the life of our pediatrics, our neonates, and it's a better outcome for the patients.
Absolutely. Well, thank you so much. Thank you for being a guest today. Thank you for traveling all the way over here to attend INS 25. We appreciate your commitment.
Thank you so much, Derek.
Thank you.
I appreciate it.
And as always, thank you for tuning in to the INS Infusion Room.
Infusion complete.